Medicare has just announced that they are expanding their telehealth services to help people access their doctors without having to leave their homes. And this is really beneficial in this time period where coronavirus is everywhere. So I'm going to explain to you exactly how these services work so you can feel comfortable using your doctors while staying in your home and not exposing yourself. So stay tuned. Hi, I'm Jamie Banner and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare. And today I'm going to talk to you about how to see your doctor while avoiding this guy over here, which is COVID-19, also known as coronavirus. Because unless you've been living under a rock, you know that this virus is everywhere. We've all been told to self-isolate and avoid this virus because it is very contagious and very dangerous. Luckily, Medicare has just released this week that they're expanding their telehealth services so we can still access doctors under Medicare without having to leave our home. And that's going to really be a game changer in trying to fight this virus. Before we get started, if you find the information in this video helpful, I'd appreciate it if you give it a thumbs up and subscribe and leave a comment down below. And we'll dive right in and talk about telehealth. So like I said, it was just released this week that telehealth is going to be expanded to everyone in Medicare. So many people don't know, but telehealth has been available for quite some time, but it was only for specific populations. And it was generally people in rural areas who didn't have access to doctors and hospitals immediately. So now it's been changed where it's going to be available to everyone to try to help stop the spread of this virus to keep people in their homes. So that's really beneficial. Telehealth services can be office visits, doctors, nurse practitioners, physician's assistants. It can also be psychotherapy. And again, that's a pretty important thing to keep up with because a lot of us under self-isolation. So it's really important to make sure our mental health stays in check. Also could be consultations and pretty much other medical and health services that you may require. So the way it works, it's a two-way communication system between you and the doctor. So it's live, audio, and visual. And essentially, you're on one screen, doctor's on one screen, and you talk back and forth. It is live. So it's not like you take a video and send it to the doctor and they send one back. You're talking just like you would in an office visit, just through your computer. So it's not as scary. Like I said, with the virus out there, you can talk to your doctor, ask questions on hand, present your symptoms, and get a live, immediate response. I will say there is only one drawback I really see with this, and that is with HIPAA law. So HIPAA is your health information protection. The laws for this are going to be a little more lax that they have said because this is kind of going to be so newly widespread. Like I said, it's been in use, but not as widespread as it's going to be. So that's something to consider. But honestly, I think the cons don't outweigh the pros. The benefits are so great of not having to leave and expose yourself. It's going to be a really great system to be able to communicate with your doctor live and really know if this is something you need to go to the hospital immediately, get checked out, or if you can kind of lay low. So telehealth, like I said, small before, now really widespread. It's going to be incredibly beneficial to help stop the spread of this virus. But what a lot of people don't know is there have actually been other forms of virtual healthcare available. So even though telehealth is now being spread out to everyone, before you actually had a couple virtual forms of healthcare you were able to use. And I'm going to talk about those in just a second. But something to keep mind of is that Part B covers telehealth. Part B will cover the next forms I'm talking about. But you are still responsible for the 20% and for deductibles. So if you utilize this, again, just like Part B covers 80%, you're responsible for 20% and the Part B deductible with this, which if you have a Medicare Supplement plan, it will pick up that 20%. So the other forms of virtual healthcare, the first one's going to be EVisit, so electronic visits. Again, covered under Medicare Part B up to the 80%. You would talk to your doctor using an online patient portal. You can use it from anywhere, from your house, from your in-laws' house, wherever you need to do it. you can use it. The whole point is just to not be in the doctor's office. Catch with this one, you must have an established relationship with the doctor. So in telehealth, you can be a new patient seeking out this doctor. With EVisits, you have to have an established relationship. So you have to have been to this doctor before. Cannot be you're calling the doctor's office for a new visit and you make an EVisit. That would work under the telehealth. EVisit providers is a pretty long list. You've got doctors, nurse practitioners, physician's assistants, and under special circumstances, it can be a social worker, a psychologist, or a therapist. So it really depends on those special circumstances. But for everyone, you can use it for doctors, nurse practitioners. It's not live like the telehealth is. You submit and then you get response through patient portal. But again, a way to not have to go into the doctor's office. The other form is going to be a virtual check-in. So virtual check-ins, again, covered under Medicare Part B, that 80%, and you talk to your doctor using your phone. So it could be you leave a message, text message, what have you. It's a virtual check-in with your doctor, and they get back to you. Again, can be used anywhere, which is really, really amazing. But you must have an established relationship with the doctor. So again, unlike telehealth, this is doctors you've seen, not a new doctor. So your doctor is going to respond by phone, audio visit, text message. They can also respond by email or through a patient portal. Virtual check-ins, it's important to know that it cannot be something that you saw the doctor within the last week for. So if you had the doctor's appointment on Monday, you cannot do a virtual check-in for that same thing on like Thursday. Same thing, it cannot be something that you would have to go into, say, the emergency room for in the next 24 to 48 hours. So if you broke your leg, you can't do a virtual check-in and then go to the hospital. It has to be something that's non-emergency. But still, it's a great service to have. And these services are going to be fantastic for avoiding things like what's going on right now with the coronavirus. And once that's gone, 5 months from now, 5 years from now, 10 years from now, there may be another virus where we need to know how to use these services. The one thing I will say is Medicare has said, hey, telehealth is widespread, you can use it, but they haven't really said how to use it. My best answer is use the Medicare.gov provider search, find doctors in your area and call and see if they utilize it, because not every doctor is going to be up to speed with technology. You know, a lot of doctors may not want to use this service, so you're going to have to find a doctor that can use this to talk to you virtually. But like I said, because it's become so widespread, I think a lot of doctors, hospitals, urgent cares are going to be getting on board to use this service because we all have the same goal, to stop the spread of the virus and keep everyone as happy and healthy as we can. So I hope you found the information in this video helpful. If you did, please give it a thumbs up and subscribe. Leave a comment down below. If you need any help with your Medicare or Medicare Supplement plans, that's what I do. I assist people in finding the best Medicare Supplement plan, which can also help you pick up the costs associated with these e-visits and virtual check-ins. You give me a call. My number is 833-65-JAMIE. You can also visit my website, medicarebyjamie.com, or you can send me an email, jamie@medicarebyjamie.com. Thanks for watching, and I hope you stay safe out there and this virus is gone before we know it.